Ethics is concerned with moral principles, values, and standards of conduct, philosophical ideals of right and wrong that define the principles you will use to provide care to your patients, to incorporate your own values and ethics into your practice. As you incorporate these values, you will explore what type of a nurse you will be and how will you function within the discipline. Veracity, also referred to as truthfulness. Under this principle, the nurse's primary obligation is to be honest in their dealings with people. That includes communicating truthfully and without deception to respect the position of trust inherent in the nurse-patient relationship. The nurse is caring for a patient who has been admitted to the hospital. The healthcare provider opts to include baclofen as part of this patient's treatment regimen, and the patient tells the nurse that she doesn't want to take any medication with side effects. The nurse recognizes that this is an appropriate medication for this patient with known adverse effects. The patient asks if the medication has a side effects. Does the nurse tell the patient about the medication? The nurse needs to be very honest and tell her the known side effects. Veracity means being willing to provide patients with facts, not offering false assurances. It is the concept by which nurses hold themselves and others accountable to demonstrate competent, accurate, and patient-centered nursing care.
Good morning, ma'am. Good morning. I am your nurse for today. I am Charesse Ann Calambro. And how are you feeling today, ma'am?
I'm a bit fine. How about you?
I'm doing fine. And can you tell me your name and your birthday?
My name is Cristalyn Divino and my birthday is February 4, 2003. And I feel not good, really good today.
At least you are now here in the hospital. You can get yourself checked.
I feel stiffness in my body and I don't want any side effects of medication.
I'm sorry to hear that, but the doctor ordered the medication for you that will use to help you certain muscles, help to relax your certain muscles in the body, and this relieves your stiffness, spasm, and tightness of your body.
Is there any side effects of the medication?
Is it safe or is there any serious side effects on the medication now?
To be honest with you, there are some common side effects you will feel like headache, dizziness, tightness of your body, vomiting, or feeling sick. But there are things to cope up with this. And if still bothering you, the side effects or still there, we have to speak to your doctor. Is it okay for you, ma'am?
Thank you, nurse.
I'll be back on you to check. Thank you.
When patients feel nurses are honest with them, it encourages honesty from patient to the nurse, which makes it easier to determine a patient's status and set realistic goals to promote positive outcomes. Second scenario. The patient was admitted to the hospital and diagnosed with diabetes mellitus and hypertension. The doctor comes in a room to inform about the patient's health condition. The patient is unconscious and only the watcher is there at her side. She's an adult and a nursing student. The doctor tells her that her Lola has a life-threatening condition and she has only a few months to live. The doctor tells her to inform Lola about her condition when she's awake. As already an adult and a nursing student, are you going to tell the condition of your Lola? And how do you tell your Lola? Therapeutic communication is also included in nursing ethical practice, which simply means how we communicate with our patients to support them as best as possible. Whenever actions, eye movements, or words, both spoken or unspoken.
Good morning po, ma'am. Ako ba yung watcher ni ma'am?
Opo.
Ilang taon ka na po?
20 years old po at nursing student po ako.
Sige, nasa tamang edad ka naman at nursing student ka pa, sa'yo ko na lang ibigay ang information about sa kondisyon ng lola mo. So, alam mo naman na may diabetes siya at hypertensive pa. So, huwag kang magulat ha. Sa totoo lang po, ilang buwan na lang po yung makakaya ng lola mo. At kung pwede, ikaw na lang po mag-explain sa kanya ng gently lang po para hindi po magulat si lola po ha. Okay lang ba yan sa iyo?
Ganun po ba, Doc? Salamat po sa pag-inform. Ayoko pong mag-worry or malungkot si Lola.
Walang anuman. I already prescribed the medication to the nurse to be given to your lola.
Ma'am, balik lang po ako maya-maya. Pagising na si Lola para painumin siya ng gamot. Thank you po.
Salamat po.
Ako ng patient.
After a few minutes, Lola is awake. The nurse returned to the room to give the medication.
Pasok. PM po, ma'am. Inom po ako ng gamot kay Lola. Si ma'am, pa-check lang po. Ano po pangalan ni ma'am?
Fiona, Aisha, Canja.
And birthday din po.
March 5, 2002.
Okay po.
Ako,
Kamusta ang pakiramdam niyo, Lola?
okay lang po, lumalaban pa rin.
Tama yan, Lola. Laban lang po tayo. Inom lang po tayo ng gamot sa tamang oras.
Yes po, ma'am.
Pa-check na po ako sa mga class. Okay na po, ma'am. Salamat po. Pwede ka na po mahiga ulit, ma'am.
The point of veracity, and the nursing student approaches her Lola about the condition.
Lola, kamusta naman po yung pakiramdam niyo?
Okay lang ako.
Lola, may sasabihin mo sana ako tungkol sa kondisyon niyo. Sana po hindi kayo magkulat. Sabi ko ng doktor, may ilang buwan na lang pong natitira para makasama niyo kami. Huwag sana kayo malungkot. Ay, lagi nitong daan na nandito lang kami.
Tanggap ko na ako. Matanda na rin ako. Importante, makasama kayo sa mga natitirang araw ko.
Kay Lola.
As with all the ethical principles, veracity in nursing is not simple black and white. Most of the time, there isn't a clear line between when lying is acceptable and when not. In every situation, must make a moral and ethical decision. It is up to each of us to decide for ourselves what to do. Third scenario. An athletic 18-year-old female patient was admitted 2 hours ago to the ward due to fracture on her right knee. She was unconscious upon arriving, and by the time she woke up, she cannot feel her right knee. Since the doctor observed that there were serious trauma to the limb of the patient and decided to amputate. The doctor tells the patient's parents about the situation, but the parents are giving false assurance to their daughter. The doctor comes into the room to give accurate information regarding the patient's condition.
So, good morning ma'am. Good morning sir. So, kayo po ba ang guardian ng pasyente po na si Miss Kimberly po?
Opo, Dok. Kamusta na po yung anak namin, Dok?
So, kailangan ko pong ipaalam sa inyo na kailangan po nating sumailalim sa malakihang surgery po sa kanyang right knee kasi malaking injury po ang nangyari sa kanyang paa, sa kanyang knee. And kailangan po nating iputulin or i-amputate ang kanyang paa po. So, ihahabilin ko na lang po sa inyo na i-inform po ang inyong anak.
Ma? Pa? Hindi ko maramdaman yung paa ko.
Yung anak natin, hindi na magpaglaro na badminton.
Mahihirapan siyang bumalik sa paglalaro, pero wala tayong magagawa, kundi ang kabutihan niya.
Ma, bakit hindi ko maramdaman yung paa ko? Hindi, makakalakad pa ba ako?
Okay lang yan ang anak. Mapabalik yan sa dating kondisyon ng paa mo at magpaglaro ka pa. Huwag kang mag-alala, anak.
Miss Kim, kailangan ko po sabihin isang importanteng balita para sa iyo. Kailangan po natin sumailalim sa iyong surgery sa right knee. Kailangan natin putulin yung paa mo sapagkat kung hindi natin ito puputulin, magkakaroon ng komplikasyon at kakalat sa iyong katawan. So, kailangan natin putulin.
Paano na yung pangarap ko?
Empathy, not sympathy. Empathy is a foundational building blocks of meaningful social interaction. It helps us communicate our ideas in a way that makes sense to others and understand others when they communicate with us. Both sympathy and empathy are important relational and emotional skills and are helpful in different contexts. However, empathy is a must-have for relationships because empathy fuels connection. It's not enough for the people we care about to acknowledge our experiences. Thus, healthcare professionals must learn to balance empathy and compassion with the ability to tell the truth.